This program provides information on bloodborne infections and their prevention. OSHA's Bloodborne Pathogen Standard and the CDC Standard Precautions Guideline will be discussed. However, this course should not be treated as a comprehensive infection control training program. Healthcare workers should learn and follow additional infection control procedures to prevent transmission of other types of infection. Since the advent of AIDS and HIV, there has been increasing concern about preventing the spread of HIV infection and other bloodborne diseases. In response, various government agencies have issued and updated recommendations and enforceable standards to address the dangers of acquiring bloodborne infections, such as AIDS and hepatitis B and C, in the healthcare environment. This video has been designed to take a detailed look at exposure control techniques and personal protective equipment used in healthcare settings to prevent the transmission of bloodborne infections. To prevent occupational transmission of bloodborne viruses, such as human immunodeficiency virus, or HIV, which causes AIDS, or hepatitis B and C, steps must be taken to control exposure in the workplace. OSHA requires all healthcare facilities to comply with its bloodborne pathogen standard. This regulation is designed to protect workers against exposure to bloodborne pathogens. It applies to all employees who have occupational exposure to blood or other potentially infectious materials. The precautions that you will take depend on the nature of your work and the level of risk. As a healthcare worker, you should ask yourself, what do I do on the job that could put me at risk? And what can I do to reduce or eliminate my risk of bloodborne infection? If you never come into contact with blood or other body fluids on the job, your risk of being infected is not increased because of your job. But if you work around blood or other risky materials, as might be the case in an emergency department, delivery or operating room, kidney dialysis unit, intensive care unit, autopsy department, or laboratory, your risk may be increased because of your job. If your work includes any direct physical contact or contact with used sharps, particularly with conventional needles or with lab specimens, or any contact with blood or other potentially infectious materials, you will need to take steps to protect yourself. One of the most important things you can do to prevent hepatitis B infection is to be vaccinated before exposure. The CDC recommends hepatitis B vaccination if you come into contact with blood or other potentially infectious materials on the job. There are 3 injections given over a 6-month period. The hepatitis B vaccine is safe and is effective for between 92 and 96% of those vaccinated. Blood tests can tell if your vaccination has been effective and if booster injections are needed. The vaccination must be made available free of charge, but you have the right to refuse it. Check with your employer or supervisor for details. Currently, there is no effective vaccine or immune globulin product to protect against hepatitis C, although therapy for HCV is rapidly changing. Universal precautions is a key component of OSHA's bloodborne pathogen standard. Although originally developed by the CDC, universal precautions is now the term OSHA uses to refer to a concept of bloodborne disease control, which requires that all human blood and certain human body fluids be treated as if known to be infectious for HIV, HBV, and other bloodborne pathogens. Many persons may not even know if they are infected, and testing may not determine if they are infectious at the time care is given. To observe universal precautions, you must use control measures where contact with blood and other potentially infectious fluids is possible. For example, in many situations you must use personal protective equipment, such as gloves, to protect yourself from contact with blood or body fluids. You should also assume that all used needles or other sharps are contaminated and able to infect you if you get stuck. Needle stick safety and prevention is another key component of OSHA's bloodborne pathogen standard. The standard calls for the use of safer needle devices wherever possible, along with other requirements. Needle stick safety and prevention is discussed in more detail in the third program of this series on work practice controls. In addition to the bloodborne pathogen standard, you should also observe standard precautions. Standard precautions are infection control recommendations issued by the CDC. Standard precautions apply to blood, all body fluids, secretions and excretions except sweat, non-intact skin, and mucous membranes. Observing standard precautions will satisfy OSHA's requirement for universal precautions, provided that all other provisions of the OSHA regulation are met. Ask your supervisor about standard precautions. Both universal and standard precautions apply to every person, whether existing infection is recognized or not. But note that the CDC also recommends transmission-based precautions, such as airborne, droplet, and contact precautions for use with residents documented or suspected to be infected with pathogens for which additional precautions are needed. For example, airborne precautions would also be needed when working with someone with pulmonary tuberculosis. You can also help control bloodborne infection by responding to an exposure incident correctly and promptly. What should be done after a puncture wound or broken skin or mucous membrane contact with blood or other infectious fluids? Wash the exposed area immediately. Notify your supervisor right away. And file an exposure incident report. OSHA requires employers to establish a log to record and track all contaminated needle stick and sharps injuries. Consult a doctor without delay. A post-exposure confidential evaluation and follow-up will be provided free of charge. It includes documentation of the incident. Whenever feasible and permitted by law, the source individual's blood will be tested to determine if there was infection. The results will be documented and made available to you. OSHA also recommends that blood be drawn immediately after exposure to be used as a baseline for comparison in later evaluations. Follow-up testing will determine if transmission of any agents has occurred. For HIV, though, the infection may not show up in the blood for 6 to 12 weeks or even longer. For HBV, blood tests can also tell you if you have had an HBV infection in the past and whether you are a carrier or have a naturally acquired immunity. If medically indicated, the exposed individual is also entitled to post-exposure prophylaxis treatment to reduce the risk of infection. For HIV, treatment with AZT and other drugs is used depending on the severity of the exposure. For HBV, if you have not been vaccinated, injections of hyperimmune globulin should be started within 24 hours of exposure, if possible. Exposure to HBV should also be treated with the hepatitis B vaccine series. Although the CDC does not currently recommend a post-exposure prophylaxis treatment for HCV exposure, they do mention that studies indicate that interferon treatment early in the course of HCV infection is associated with higher rates of resolved infection. Again, attention should be given to the rapidly changing therapies for HCV. Finally, you are entitled to medical counseling about your risk of infection and your risk of infecting others, and you have a right to an evaluation of any reported illnesses. Whether you are infected or not, your employer or supervisor must keep your condition and medical records confidential. Remember that even though your chances of being infected are still low, it is important to exercise precautions because it is possible for just one exposure incident to infect you. Even though you may perform tasks where there is a risk of exposure to bloodborne infection, you can still work safely because universal precautions have been developed to protect you. One of the most important strategies found in both universal precautions and standard precautions is putting a barrier between you and the possible source of infection through the use of personal protective equipment, such as gloves, a mask and protective eyewear, or a protective face shield, and protective clothing. Your employer must provide you with clean protective equipment for each resident, and you should know where the equipment can be obtained. You should know when to use it, how to put it on correctly, how to take it off safely, and what to do with it after use. Gloves are the most commonly used type of personal protective equipment. Gloves must be worn whenever there is a danger of touching or handling blood or other potentially infectious materials. For example, when changing a dressing, and when cleaning up and decontaminating a blood spill. Gloves must also be worn when drawing blood or performing any other invasive procedure. You should wear gloves during resident contact if you or the resident has sores, skin rashes, broken skin, bleeding, or open wounds. However, to prevent chapping and other skin irritations, only wear gloves when there is a risk of exposure. There are different kinds of gloves for different tasks. Non-sterile gloves or examination gloves are used for many care procedures, such as removing a dressing or bathing someone with bed sores. Sterile gloves are usually used for invasive procedures, such as placing catheters or tubes. General-purpose utility gloves are recommended for cleaning procedures, such as handling soiled linens or decontaminating care areas. Utility gloves are more tear and puncture resistant than other protective gloves. If you wear hand jewelry, minimize the amount or remove it before putting on gloves to prevent tearing. And be sure to perform hand hygiene prior to wearing gloves. Always select gloves that are the correct size. Wearing the wrong size can make you clumsy and lead to an exposure incident. When putting on gloves, examine them to make sure they are free of holes or tears. Remember to change gloves as soon as is practical if they become contaminated or no longer effective due to sweat from your hands, or if they have holes or tears. Be sure to perform hand hygiene before re-gloving. And when taking off gloves, avoid skin contact with the outside of the glove by grasping the other glove at the cuff and pulling it off inside out. Disposable latex or vinyl gloves should always be thrown away after each resident. Never wash and reuse them. Utility gloves may be decontaminated and reused, but throw them away if they have holes or crack, peel, or fade. And remember, you should always perform hand hygiene with an alcohol-based hand rub or by washing your hands before putting on gloves and after removing them. Be sure hands are thoroughly dried to prevent chafing and skin irritation. Also be aware that gloves, even heavy utility gloves, cannot protect you from needle stick injury. If you are allergic to the gloves your employer normally supplies, your employer must provide you with an alternative, such as gloves made from vinyl or nitrile. Face masks, face shields, and protective eyewear are used to protect the mucous membranes of your eyes, nose, and mouth. They should be worn whenever there is a chance that blood or other infectious materials will splash, spatter, or spray. Use your best judgment in determining when to wear them. Face masks are ineffective when they become wet during long procedures and should be replaced as soon as is practical. Face masks and eyewear should only be removed after performing hand hygiene. To avoid possible broken skin contact, the eyewear should be handled by the arms. The face masks should be handled by the ties or strings. Used face masks should be properly discarded and the eyewear cleaned and disinfected. Also, protective resuscitation equipment, preferably the kind with one-way valves to prevent fluids from entering the rescuer's mouth, should be readily available for emergencies where mouth-to-mouth resuscitation is anticipated. In addition to face masks and eyewear, protective clothing with long sleeves, such as disposable gowns, must also be worn when there is a risk of splashes of potentially infectious materials. Use your best judgment in selecting the necessary equipment. Keep in mind that protective clothing must prevent blood or other body fluids from passing through to your clothing. Protective clothing must be removed as soon as is practical if it becomes soiled with blood or other body fluids. To remove a soiled disposable gown, be careful not to touch the outside of the gown. Keep it away from your body and roll the gown into a ball so that the contaminated side is in the center. Dispose of the gown, and be sure to decontaminate hands. Personal protective equipment that is not disposable, like lab coats, must be laundered by the employer. When removing a soiled lab coat, be careful to avoid touching any contaminated areas, and remember to wash your hands after handling it. There are many ways to protect yourself and others from bloodborne infections like AIDS, hepatitis B, and C. You should follow the exposure control measures, universal precautions, standard precautions, and needle stick precautions, and use all the personal protective equipment every day on the job. And be sure to learn the specific precautions you should take for your particular job. If you apply what you have learned on a daily basis, you should be able to perform your job safely and with confidence.